Today, I'll tell you about the IVF cycle, what are the steps involved, and how you have to prepare yourself to undergo the IVF cycle, how much time it takes, and what duration, if you're coming from abroad, you need to stay in India. Now, when your doctor tells you like IVF is only the mode of treatment now to get pregnant, when you've tried rest everything, nothing is working out and you have planned to go for IVF. So that is the time you need to prepare yourself physically and mentally also. Because IVF, it increases the chances of pregnancy as everything is happening outside the body. Your tubes are bypassed. We come to know the quality of eggs. Then the ICSI is done for few patients where the sperm is selected and it is injected inside the egg. That is intracytoplasmic sperm injection to increase the chances of fertilized eggs to have the good number of embryos. Still, the success rate is not 100%. We definitely increasing the chances of pregnancy up to 60-65%, but the success rate for every individual depends on many factors. Now let's see how we have to move for that, when to come to the doctor to get the treatment done. If you're coming from abroad or from outstation, try to come 2 to 3 days before the cycle starts, because the treatment starts as and when the bleeding starts. So we get those 2 to 3 days before the cycle to prepare you for IVF or ICSI. So there will be certain blood tests which will be done to see you're medically fit to undergo anesthesia and to plan for the pregnancy. Your ultrasound will be done to know what is the ovarian status, what is your ovarian reserve, how is the uterus and the endometrium. Once we have all the reports and they are okay, then we wait for the cycle to start. And as soon as the cycle starts, from second day of the bleeding or the third day of the bleeding, the injections will start. Now these injections, they are the hormonal injections. The aim is to produce multiple follicles, and these injections can be taken at your own place. You can take them yourself also. You don't have to come to the hospital daily to take the injection. They are daily roughly for 8 to 10 days on an average, which are given to the patient. And in between, we'll be calling you for ultrasound to see how many follicles are growing and what the sizes are. Based on the size of the follicles, we tell you the dose of the injections. We adjust the dose of the injections. So the protocol is not a fixed protocol for all the patients. The protocol, the number of days, and the dose of the injections depend on the patient age, the number of follicles which we see in the ovaries, and their AMH, and how they are responding to the injections. So once the follicle size reaches 17 to 18 millimeters, we do the hormone test to assess that the eggs which are going inside the follicles, they are getting mature. And then the trigger injection is given. 35 to 36 hours after the trigger injection, we plan for the egg retrieval. Now this egg retrieval is a simple procedure, but it is done under general anesthesia. It is a day care procedure and is done in the same way like we do the transvaginal scan. The needle is introduced through the vagina and the fluid is aspirated from the follicles. Then it is checked under the microscope to see if the egg is there or not. The same day, the husband is asked to give the semen sample. The sample is prepared, it is centrifuged, and then the healthy sperm is selected. It is taken into the pipette and injected inside the egg few hours after taking the eggs out. The patient is advised few medications to be taken after the egg retrieval, and they can go home 2 to 3 hours after the egg retrieval procedure. So it is a day care procedure, and there is no cut, no stitch, no overnight stay. After the procedure, the doctor will advise them the medications which need to be taken and to carry on all the normal routine activities. The next day of the egg retrieval, we check for the fertilization status, and then they're grown in the lab for 3 to 5 days. And based on the number and the quality of the embryos and the overall status of the patient, we decide whether the embryos need to be transferred in the same cycle or they are frozen. And then after giving a break of one cycle, when the ovaries they come back to their normal thing, the hormones come back to the normal, then the patient is prepared for the embryo transfer procedure. That is known as frozen embryo transfer cycle. Now, preparation for frozen embryo transfer cycle is very simple. They're given few medications to prepare the endometrium of the uterus, and when the endometrium is ready, in between they will be called to the hospital to check for the endometrium, and when the endometrium looks ready, we plan for the embryo transfer procedure. Embryo transfer procedure is again a very simple procedure. No anesthesia is required for that. Patient will come with a full bladder. They'll be given the instructions to which medicines to be taken, which injections to be taken, and then after the procedure, half an hour later, they can go back home with all the instructions which given by the fertility specialist. The waiting period is of 2 weeks. 2 weeks later, they come to know about the pregnancy by doing the pregnancy test, whether the pregnancy has happened or not. And then the instructions are followed if the pregnancy is there. 1 week later, we do the ultrasound to see how many sacs are there, and then the growth of the pregnancy is monitored. So, during the entire procedure, there is no hospital stay. It is a daycare procedure. There is no cut, no stitch. And if the embryo transfer is done in the same cycle, in the stimulated cycle, it takes 3 weeks time on an average. But if we plan for the frozen embryo transfer cycle, then it takes roughly 5 to 6 weeks time. So the patient who is coming from abroad, they have to plan for the 6 weeks time duration of stay in India. And if the patient is from the same state or the same city, then as per their convenience, they can plan for the frozen embryo transfer cycle in any cycle time. It's not necessary like they have to come immediately after 1 month break. It's as per their convenience. We can plan for the frozen embryo transfer cycle. 2 weeks later of the embryo transfer, the pregnancy test is done. That is by the blood test beta HCG. And if the pregnancy comes out to be positive, then the medications and injections, they are continued and followed by the ultrasound after 1 week to 10 days to see for the number of the sac inside the uterus, and then the patient are given the further instructions to continue, how to continue with the medication, and then they can, if the patient has come from abroad, they can go back to their own country and follow the instructions. If the patient cannot stay for that duration in India, then they can go back in between after getting the egg retrieval and can come back for embryo transfer as per their convenience. So that time the stay will be approximately for 2 to 3 weeks. It's not necessary to stay in India after the embryo transfer. They can go back to their country with all the instructions given to them.